Hi, welcome to this short video from the 5 Minutes of Supervision series on excellence in the in-training assessment or term assessment. My name's Matthew Links and I'm the Discipline Lead for Medicine at Bond University here on Commonberry country on the Gold Coast. In-training assessments are an important, sometimes challenging part of supervision. This talk aims to give you some guidance about what excellence looks like and tips to achieve it in a time-effective manner. A good place to start might be what we tell students, and it is really the case that an ITA is what you make it. It's either a tick box exercise or a vehicle for improvement. We encourage our students to plan, be brave, be excellent, and take responsibility for this process and responsibility for demonstrating their excellence. Good ITAs depend upon all of the features of good supervision we've been emphasising in this series. It's grounded in a relationship of care and learning. It depends upon evidence, particularly observed practice. It grows with high quality feedback, and it's performed by a supervisor who role models good practice, motivates and inspires. So let's look at these in more detail in relation to the ITA. Like all supervision, it all depends upon the relationship. The first step is for the students to know who the supervisor is, with an allocated responsibility for doing the ITA. The second thing is that the student is included in a culture of care and learning that encompasses the patients and the entire team. This is what makes for a positive learning environment. And the third thing is that conversations need to be done face to face. Filling in forms is not the focus. The focus is a conversation, and there's no substitute for doing this together. Being learner-centred for an ITA means that judgments made are informed by where the learner is starting from and what their goals are. It's also aware of how the student's well-being is impacting on their performance. For example, if they just lost a parent, and it can be enabled by making the student responsible for gathering the data that supports assessment and in giving feedback that starts with the learner's perspective. It's important to remember that the ITA is an opportunity to motivate, inspire, and to role model good practice. The content of the ITA conversation can achieve this, but don't forget the impact of the way you conduct yourself as a supervisor. So an ITA is really a team exercise. The supervisor integrates and makes judgments, but does not have to do all the work. The healthcare team and the student are key team members, but distributing the work takes some planning. The first step is a conversation at the orientation, with the supervisor outlining the student's responsibility to make the process happen. The team members who can help to provide evidence by giving feedback and doing workplace assessments, and how feedback from the team members will feed into the ITA process. The second step occurs during the ITA. The student can present the evidence they've collated, and the supervisor supplements it with the evidence from the team members and their own observations. The third step is making an evidence-based judgment and documentation. This involves feedback for improvement and comparison against a standard. So let's discuss comparison against a standard. One of the most difficult issues for supervisors is defining the standard, and it's particularly hard if you don't have a lot of experience in supervision. It's also hard because we all have biases that need to be minimised, and we're all on a spectrum of markers between hard markers, hawks, and easy markers, doves. So where does the truth lie? Well, having an evidence-based approach helps. Being self-aware and checking in with colleagues also helps calibrate yourself against others. Some critical questions to help decision makings are: how has the learner responded to feedback? Are they on a trajectory of improvement? And ultimately, is this person safe? Would I give them a job? Remember, failure to fail is an ethical issue. This rotation ends, but the process of learning goes on for you and for the student. The ITA is a key opportunity to connect the student into their next rotation and set up the process of identifying learning gaps and goals. For students in difficulty, seeking consent to pass on information that would help the next supervisor is very helpful, and the university and hospital can then make this happen. And for you as a supervisor, it's an opportunity to reflect on what went well and what didn't, feeding this forward to your next learners. So excellence in an in-training assessment starts with an allocated responsibility and is supported by face-to-face conversations. It's grounded in an understanding of the learner's gaps and goals, and it's a process of gathering evidence, giving feedback, and making evidence-based judgment. Evidence comes from direct observation, workplace assessment, and input of multiple observers in the team. And the impact of this conversation depends upon it being conducted in a relationship of care and on the connection to ongoing learning. Thanks for your attention. Please visit my other talks and leave a comment or a request for other topics. Good luck, and may your ITAs be positive experiences for both you and the students.